It's 5 o'clock on what is today, October 18th. And my name is Dr. Richard Kim, and this is our monthly webinar. This is an informal informational session for anybody interested in stem cells, wanting to learn about stem cells and what it can do for you. I like to start pretty promptly here, so I'll try to minimize taking up your guys' time. So this is the first slide, just some quick information. Make sure you have your volume up. On the lower left hand, you can see the question and answer. If you want to ask questions either during this process or throughout, I can see all your questions and I'll be able to answer them at the end. And we have I have some prepared question and answers that people have been asking over the last month, so I'll be sure to include that. So let's get going. And so the point of this is, of course, to learn about how stem cells actually solve pain. So that's the point of it. And let's get to the first slide here. So on the first question that somebody actually asked, this was from Audrey R. in the 518 area code, says, I want to know everything about the procedure. And of course, I sort of take this to mean, who is this for? And I really think that this is for anybody who's got a musculoskeletal complaint, right? A hip pain, a knee pain, a back pain, a neck pain, needing a solution that's non-operative and not medication. We all have the same and similar common goals. We all want to, number one, avoid surgery. We all want to stop medications or not rely on medications. And we also all want a quality of life. But how do we get there? When we talk about seeing physicians or seeing doctors or trying to achieve some of these goals, one thing that I hear commonly from people is that we want to plan. I want to sit with a doctor, I want to sit with a caretaker, I want to sit with a healthcare provider and sort of map out how that's going to happen. And number two, we want it to be safe. We want something that's low risk. We want something that's got short recovery. We don't want to be recuperating for a year. And number three, we want to avoid pitfalls. We don't want anything illegal. We don't want anything that's going to require me to travel to some third world country to obtain. Here's a couple of examples for that have occurred in our office over the last, I'd say, year that might be relative to everyone. The first one's a retired psychologist who flies airplanes for a hobby, also a runner, runs competitively, but primarily for stress relief. But the back pain ended his running. That meant no more competition, no more fun, no more stress relief, and really limited his ability to fly his airplane, as he couldn't withstand more than 30, 45 minutes in that seated position before he had to put the plane down. The second is an example of a younger patient, a chef in the middle of his career, really enjoys spending time with his family, but the work is constant. There's constant movement, there's constant picking up of heavy restaurant equipment. And the back pain was really affecting his work. It would made it difficult to make it through the entire workday. And the patient contemplated actually changing careers. Traditional medicine failed these people. The limits of traditional medicine are listed. Number one, it's surgery. A lot of people are against. These patients were against for these very reasons. It's permanent, it's invasive, often involves a long recovery. We're not talking about a couple days, a couple weeks. We're talking about 6 months, a year, sometimes even more. Number two, steroids. They're oftentimes a Band-Aid. And as these Band-Aids go, they also happen to weaken and damage tissue. And that's, of course, not what we want. We want to be in a position where, these tissues are being improved, being healed, and giving us strength rather than the opposite direction. And then, of course, people are getting repeat steroids. So if you get repeat steroids, you're ending up with a repeated exposure, means repeat weakening and repeat damage of that tissue. Next is medications. Sorry. The medications our over-the-counter medications or prescribed can lessen our symptoms, but eventually the effect wears off. And what does that mean? That means you have to repeat the dose to get the same effect or anywhere similar. What happened to these patients? 2 months after stem cell therapy, our psychologist was back to running, ran the 4th of July 4-mile race that we have here in our local Saratoga. He was running a 13-minute mile pace. He wasn't happy about that fact, but nonetheless happy about running. And he was also confident enough to train for a half marathon with his grandson, which is due to happen early next year. And for the chef, he's back at work full-time, able to provide for his family, and obviously ecstatic about that. So how exactly did we do that? The important thing is that you've got to break the cycle. And this is a good example of a simplification of the cycle. When you have pain, it leads to degeneration. And when you have degeneration, it leads to further pain, and so on and so on. Until, of course, you're doing less and your quality of life is suffering, and the things that you love and want to do just start exiting the picture. I really consider regenerative medicine and what we do to be the third solution. It's not invasive surgery. It's not a medication. Here are some of the benefits. Number one, it's got a high success rate. And when I say high success rate, we're talking about something that it will do better than surgery, will do better than traditional medications. We're talking about something, number two, we're talking about something that'll give you years of relief. So not something that you've got to go and get repeated exposure every 3 months, but one cycle therapy for us is oftentimes lasting anywhere from 5 to 10 years. And number three, we're talking about guaranteed acceptance. So no rejection of the tissue, no rejection because there's no hardware. This is all your cells taken out of you, put back into you, and then therefore it's a guaranteed acceptance. How this is different in maybe compared to other solutions is depicted in the graph there. This is a cellular process. This is a biological process. So it's not like we do the process and the next day you're healed and you're off to running. It is something that takes time, and it requires some level of patience. It requires some level of effort in terms of gaining strength and restoring mobility. But it is progressive and it is gradual. And then anybody who's had this or spoken to any one of our patients who's had this, they'll say just as much. I was better at a month. I was even better at 3 months. I was still better yet at 6 months, and so on. So here's a live example of how the stem cells actually work. If you think about the top right corner of that picture of the video here, that red is bad and green is good. When I say red is bad, red is really what pain is. It's what stiffness is. It's sciatica, nerve pain, neuropathy, that shooting sensation, or sometimes that aching or grabbing. But green is the stem cells. It's how it attacks the area of damage, how it attacks the areas of pain, stiffness, sciatica, and so on. Well, what exactly is regenerative medicine? So regenerative medicine is a new field of medicine, and the purpose of this is different than, say, the other solutions, which is, again, why I call it the third solution. It's really meant to restore, not replace the tissue. So it takes your own body's natural tissue and puts it back into a more functional space. We're talking about damaged tissue into healthy functional tissue. And different materials are used in this process. So platelet-rich plasma is that small dark green circle, and stem cells would be the light green, much bigger circle. Platelet-rich plasma, great for smaller problems, but obviously by the size of the circles, I'm trying to illustrate the power of the stem cells in comparison to the PRP. This is another good example that I like to use to describe how exactly the stem cells work. If you think about one of our favorite games here, Pac-Man, the pellets that Pac-Man goes around gobbling up are the inflammation. And if you can imagine platelet-rich plasma as one Pac-Man going through, and then alternatively, you can see what stem cells would equal, which is about 1,000 Pac-Man packed into the screen, going after all the pellets all at the same time, plus the inclusion of the power-ups. I know I'm being a little bit funny here in this example, but it's a good illustration of what actually is happening within your back, within your knee, within the different spaces that create pain. The goal here is with stem cells or with platelet-rich plasma is to beat the game entirely. It's to stop playing it. So once you're better, rather than going around and chasing the inflammation and making it better and then getting to the next level where there's more pellets and repeating the process over and over, it's to exit the game entirely. With our therapies, and this is something we've again readily seen, is something that lasts 5 to 10 years. So imagine not playing, the inflammation, pain, and trying to make it better game for 5 to 10 years at a clip. So where exactly do the cells come from? The picture there on the left, the spinning set of bones is your pelvis. And on the backside of the pelvis there's what we call a straight ridge. And it's a fairly narrow margin of bone, but we use a specialized needle, enter that space, extract the material. And where are we putting it? In the case of back pain, we're putting it back into the discs primarily. Some other places are involved, but the picture on the right shows you what the degenerative disc looks like and what we aim to do after we've injected it. We aim to heal it, make it more normalized, and restore its function. And you can see once you do that, you're taking pressure off of the spinal cord, pressure off of the nerves. In our office, this is what a typical timeline and schedule of the therapy looks like. We start off with a simple consultation, which would involve either meeting me or meeting our nurse Kragan, and then we go on to have an MRI if one is applicable. Then pretty quickly, the first PRP, which tends to be a 1-hour process, whereby we withdraw your blood, process it, inject it back into you within that first hour. And where we inject it is different for each person, different for each body part or body part that's arthritic. Then 2 weeks later, we're doing the stem cell and then an additional PRP at that point. Then 4 weeks later, the third PRP. So PRPs 1 and 3 both take about an hour. PRP and stem cell take somewhere between 3 to 4 hours. And as you can see, after the third PRP, physical therapy, chiropractic care, exercises, these are all the things that return and help you then go on to build that strength and carry you through the long term. See some common diagnoses that we take care of. Number 1, stenosis, one of the more common ones we see, arthritis, degenerative disc, sciatica. But it's not just exclusive to the neck and the low back, the lower body, the hip, the knees, any sort of arthritis, bursitis, and meniscus issues of the knee, Achilles tendon of the ankle, and so on. Similar upper body rotator cuff issues, again, arthritis, very common in the shoulder as well. Tennis elbow, carpal tunnel. So a number of different diagnoses all apply to the similar therapy. One thing we hear a lot of is am I a candidate? And the way we really sort of think about this is that anything that can be injected, anything that can be operated on, is amenable to stem cell therapy. So disc issues, neck arthritis issues, meniscus issues, these are all able to be treated with stem cells. So my typo there. An important part of this is a diagnosis. You have to have an accurate diagnosis. I can't emphasize this enough, in that it leads to accurate therapy. For us, it was such an important issue that we obtained our own MRI. We are the only regenerative medicine provider in, I don't know how large a swath of area, with our own MRI. So what if you've had surgery? And the short answer is yes, you can still have regenerative medicine procedures. An important part of this, of course, is that during the consultation, we need to understand what sort of surgery you've had, what kind of results from it, or why you're still having pain. Which leads us back to the very important statement I said before, was that we need diagnosis, and that usually involves needing imaging. Here, as always, a history and exam is critical. For us, type of surgery is important, whether it was arthroscopy of the knee, did you have a fusion of the spine, was it a rotator cuff surgery? So here's some simple, frequently asked questions. Where will my stem cells come from? 100%, they all come from you. So whether it's your bone marrow or coming from your fat, then we take them from you and then inject them back into you. Number two, how long before I can become active? So immediately after the stem cell processor, that timeline that's a stem cell and PRP number 2, we have you essentially rest for a few days. We want to hold back activity for about 4 weeks. And then after 4 weeks, we liberate activity. We just saw a patient with a knee issue today. He was ready to go back to doing squats, asking about jogging. Yes, all of those things are possible. Next, when do I start to feel the benefits? So a little bit different than the second question. So the majority of our patients feel a difference within the first 4 weeks. But if you remember the pictograph or the image talking about when you're going to feel a difference, during the first 4 weeks, you start to feel a difference, and then it just gets progressively better. So that's an important part of it. Sometimes we'll hear, well, when am I going to get better? When am I going to get better? And then people start to feel the difference, but they're sort of looking for that peak of symptom improvement. And sometimes that can take, obviously, a few weeks. Next question, how long will the tissue stay repaired? And again, we're going back to a 5 to 10 year time frame. So I know it's a little bit hard to believe because we're so used to things and steroids where we need them every 3 months and you have to go to physical therapy and chiropractor every week or every other week. This is different. We're talking about a single cycle therapy that has the staying power of multiple years. And this is pretty evidence, not just in the literature, but in my patient population as well. We've been doing this for 9 years, 10 going on 10 years, and have seen this pretty readily. Next question about how well does this work? Again, very different per person, per area, per severity. But you'll hear a pretty common statement in our offices that typically 85 to 95% of our patients getting anywhere from a 75 to 85% result. This isn't the same for everybody, but it's a good way to encapsulate the fact that the majority of our patients do majority benefit. And so that's a way of saying that. So let's get to the question and answers. The first question is from Susan D, who is from the 315 area code, and she asks, "Can spinal stenosis be cured without surgery?" And essentially, the answer to that is yes. If you look at the two images of the spine there. The image on the right shows what we call a cross section. And so those little yellow dots in the center are the spinal cord. The blue sort of jelly donut looking item pushes backward onto those yellow dots, and that's your disc pushing on the cord. But with our therapies, that pressure onto the cord is improved and relieved. It doesn't change the fact that you have stenosis. So you're always going to have stenosis, but you may no longer have the symptoms associated with the stenosis, in which case we often ask, well, do you really care that you have stenosis if you don't feel anything, or you don't feel the effects of it? And so, yes, in the sense that the symptoms are curative, but maybe perhaps the diagnosis stays with you. It's a very common diagnosis for us. We treat it weekly. Sometimes I feel like even more than that, if not daily. History of responding very, very well in our office. Important elements are, of course, consultation and MRI, so that we understand how severe your symptoms are, how severe your stenosis is. Again, single therapies lasting anywhere from 6 to 10 years and completely repeatable. You can do this and have the results lasting, the same amount of time the next time around. Jackie B from the 802 area code asks how to treat the stenosis in my lower back and the resulting pain in my hips and glutes. Again, similar to the question below, previously. The answer is yes. How to treat it? Similar to what we've been talking about, regenerative medicine, platelet-rich plasma, stem cells. The thing about stenosis is that oftentimes affects the nerves of the lower legs, the hips, and the glutes. Sometimes, again, only requiring a single therapy. Important elements are, again, MRI and physical exam. But the important thing here to note is that stenosis can lead to these lower extremity problems. So if you feel like, well, maybe I have a nerve issue, or sorry, an issue with my knee or my hip, it may actually be coming from your back. That's why the consultation is as important as it is. Mary B, who's asking from the 585 area code, stem cell treatment after spinal fusion. Yes. So fusion is what fusion really is, and you can see the picture here, is a surgery using plates and screws, or bars and screws in this case, to fixate two vertebrae. So basically they drill straight into the bone, preventing you from ever having motion at that vertebrae levels. The problem here is that it creates problems new problems at the disc above and below. So kind of like links in a chain, if you force two links to never move again, the link to the left and to the right of it need to do more work to make up for what's been fused. And oftentimes we see this, and we see people with the deteriorating disc above and below, and treatment of that disc will certainly give them significant pain relief and reduction. Gerard C from the 518 area code asks about thumb joint degeneration. Yes, thumb, wrist, finger, arthritis, small joints. And what's important in this takeaway in this one is that there are very few options for people who have pain in those areas. A thumb replacement or a wrist replacement just really doesn't exist, or not easily anyways. So we're talking about, for us, a therapy that results in people being able to see results in as little as 4 weeks. But this really applies to things like ankles, feet, plantar fascia, a lot of other areas that people feel and see symptoms or have degeneration, arthritis, tendon issues, who don't have a lot of great options. Now, Another one is from Wayne V in the 802 area code and Francis W in the 518, asking about cost. So important to note that our practice, as well as any regenerative medicine practice, is not covered by insurance. And there's, for us, a large number of variables that go into this calculation. And so cost ranges quite greatly. It really depends on the body part, the severity, and for anybody who comes in for a consultation, we'll have a pretty good assessment of what you need by the end of that consultation. And of course, you know, that'll be presented to you at the end of that. Robert W from the 315 area code, have really bad back, trouble walking. Is there a fix? Yes. So similar to before, the back problems can affect the nerves that control the legs. Addressing the original back problem is going to improve the nerve function of the legs. A single cycle therapy with us addresses not only just the back pain, but these nerve issues as well. And obviously these nerves that control walking are important to address, important to not ignore. For people who are having trouble walking, a very critical portion to all of this is developing that strength afterwards, being able to regain that strength afterwards, regain that mobility. So physical therapy after the therapy, after the original cycle therapy is important to build strength. Again, consultation, MRI. Marco C from the 438 area code asks about relief of my leg pains caused by my lower back damage. So again, back problems leading to nerves can affect the nerves that control the legs. For us, there's really two main factors that help contribute to successful therapy, and this is speaking directly to the nerve issue. And the first is the length of the time that the patient has had for the leg pains. And number two, whether or not that leg pain tends to come and go. So if it's there and chronic and permanent versus ones that, you know, well, when I get up and I walk, it gets a little bit worse, versus when I sit down, I can get some relief, or that sometimes I won't feel it at all. These sort of elements about your history are very important for us to help assess the viable success of the therapy. Heather P from the 315 area code, how this can help chronic long-term back pain due to arthritis, degenerative disc disorder, and activity-related injuries. So this is probably one of the more important slides of this whole talk. It's a good summation of everything I've just said. Arthritis and degenerative disc disorders and disease create these toxic buildups, the pellets in Pac-Man, for example. We feel this toxicity as pain, and the point of the stem cells is to clear that toxicity buildup, and we're talking about for as long as periods of 10 years. So that's a pretty big statement, I realize, but it is one that we do day in, day out. We see day in, day out, and with great evidence. We just saw somebody in follow-up earlier this week who is, I believe, 3 years out from the stem cell of her back, you know, continuing to garden, continuing to travel, and we've effectively, with one cycle, kept that toxic buildup away. Consultation, again, an MRI, helping us to match that pain to the areas of the arthritis. Agnes M from the 315 area code, lower L4, L5 torn disc. So unfortunate to hear that, Agnes. Disc tears are known as annular tears. This is a pretty good picture of what an annular tear looks like. And you can see the herniated disc material, that blue blob within the purple wrapping. Once the purple wrapping starts to unfold or starts to tear, that blue material likes to push through. Tears lead to herniation and nerve-related symptoms. Untreated discs will only progressively worsen. So I'm going to say it again. Untreated discs will only progressively worsen. That's how degenerative disc works. You'll feel it at different to varying stages. Some days you may not feel it at all, and sometimes you'll feel it 3 weeks in a row. And for some people, they feel it every day. Our therapies really are aimed to heal the disc and, again, relieve the pressure off of the nerves. Peter B. from the 315 area code. I have chronic back pain from stenosis and degenerative disc, low back. I've suffered for years, have tried everything, physical therapy, chiropractic care, acupuncture, everything but in surgery and nerve block. So physical therapy, chiropractic, and acupuncture care are what we call non-invasive, right? They're from the outside in. They're great starting points for a lot of people. But sometimes these deep structures, those nerves, the disc, the deep muscles and ligaments and tendons can be really hard to reach. Surgery can reach those depths, but obviously involve quite a bit of destruction in getting there. Cut, move tissues, cutting muscles, cutting ligaments in order to get to those deep locations. Our therapy is what we call minimally invasive. That means with the fine needle, we're able to get to that depth without the cutting, without the movement of the tissue, without the cutting of the muscles, without the cutting of the ligaments. So what we're doing is getting to the depth with the least amount of damage, or I like to think with zero damage. Terry Ann from the 315 area code. How Dr. Kim treats back pain from old L1 fractures, arthritis, and stenosis. So this is a great question. And this requires a little bit of instruction and knowledge. So if you can see that picture there with the red arrow from the bone piece going all the way to the intervertebral disc, excuse me, intervertebral disc. So nutrition from the bone flows from the bone through the end plate into the disc. Therefore, if you've ever had a fracture or you ever develop arthritis, it damages that flow of nutrition. That means that that disc becomes dry and it becomes damaged, and only worsens over time. Now, not overnight, not over the course of maybe a week. We're talking about years, and we know this, right? So this year I was not as good as I was the year before, and and still not as good as the year before that. And you can look forward to the next year being worse yet still. Why? Because it is a progressive and degenerative problem. And of course, once the discs become dry and damaged, that's where the pain and stiffness come in. And we talked about those little red and green areas. This is a question from Mary Ann N in the 716 area code, interested in stem cell for bulging and ruptured lumbar disc and the related back pain for her husband. So I put a picture of a sponge here because this is one of my favorite analogies, is that if you can imagine a brand new wet sponge, and that's what our discs look like when we are babies or when we are in our youth. But progressively over time, as the water leaves, as the jelly leaves, as we develop tears and bulges and protrusions, our discs unfortunately start looking like this sponge here. The purpose for us really is taking that sponge and putting it under the faucet and helping it rehydrate. Obviously, you can't put it under a faucet, but what we can do is restore that sponge or that disc with stem cells. And that's really one of the more amazing phenomenon that occur with the stem cells, is that you're restoring the health of the sponge. Your sponge won't look like when you were 3 years old and new and full again, but nonetheless, certainly better than what we've got as an example here. This is coming from one of our French patients, French-Canadian patients, I should say, Marie-Lynn R. from the 514 area code. Wants to learn about stem cells, interested in for her partner. And this is just a little more informational. We talked obviously a lot about stem cells, talked a lot about regenerative medicine, talked a lot about platelet-rich plasma. But for French-Canadian and our Canadian patients, we do offer French translation in the office. No referral is required. For us, the MRI is included, so that's not something you have to try and get within your Canadian healthcare system. And we have an office that's simply 1 hour from Montreal. To reiterate, we have our plan is for typically 3 visits within 6 weeks. This is not a surgery, and you can look forward to short recoveries. Another one from our French-Canadian counterparts, Serge A from the 514 area code. Can stem cell injection cure herniated disc? And as we talked about before with that sponge idea, with the annular tear idea, the answer basically is yes. Herniated discs respond very well to our therapies. First response usually within about 4 weeks. Again, 3 visits in 6 weeks. Northern office is only an hour from Montreal. This is a question from George M in the 518 area code. Stem cells and knee injuries. I play tennis 3 to 4 times a week. So this is a great one. And I can tell you this is culminating from 9 to 10 years of my experience with regenerative medicine. But the patients who are interested in getting not just pain-free, but getting back to activity in sports, even just walking, even if it's simply just walking, always do the best. And that's again from my years of experience. So if you have a high desire for activity before, it's going to result in a much better result for activity afterwards, if that makes sense. Excuse me. Okay. Gilda P asked from the 518 area code, why is this not approved by the FDA? I would love to be able to relieve back pain. Gilda, sorry that you have back pain, but we can help. The FDA's role. So the FDA's role in this is very prescribed. It's what FDA does is not either approve or disapprove, but they have a clear set of guidelines in which people who do what we do need to follow. And it's a long story, but suffice to say, it is something that those of us who do this need to adhere to it, and of course, without a doubt, we have for the last decade. So it's not so much an approval, but a guideline, and a guideline that we certainly follow. Okay, so that's the end of my questions there. I see 3 questions on the Q&A, but let me get this a little blurb out. So for everybody who's attended the webinar today, my offer to you is for a free consultation. We just ask that you call by Friday at noon. Our office is closed at Friday noon. Please mention the fact that you saw us on the webinar. That's important to us. And then, of course, schedule a consult. Our phone number here is 518-871-9900, and that works for Montreal, Skinny Atlas, Syracuse, and patients anywhere. You can learn more about us at richardkimmedicine.com. You'll see our next webinar dates coming up fairly soon on November 15th, again at 5 p.m. And if you forget that, that's okay. If you just go to richardkimmedicine.com/webinars, you'll see that invitation once more. For those who are interested in perhaps taking the first step of getting an MRI, richardkimmedicine.com/MRI. You can schedule your own MRI and then come in to talk to me about it, and we can go over the results together, and I'll give you all the salient points about your arthritis or why you're having pain, and then help you map out and plan a road to recovery and a road back to activity. So let's go to some of our questions and answers here. Sally asked this early on, says, I have a permanent DVT filter and have been advised not to have an MRI. Is it necessary to have an MRI to receive stem cell treatment for spinal stenosis, which has been diagnosed? And the answer is no, MRI is not required. There are other things that you can do. So CT scan is a great alternative. X-rays if we have to. We do like MRIs because they tend to give us the most amount of detail. But again, of course, not everybody can have an MRI. And if you can't, it's easy for us to work around and have had many patients go that route. Next question. Jenny asks, what kind of stem cells do you use? So there are really only two types of stem cells. One is called autologous, and number two is called allograft. Autologous, auto means it comes from you back into you. Allograft means that it comes from somebody else into you. In this country, autologous is the only one that is allowed by FDA. Again, I'm going to say it again. In this country, autologous is the only one allowed by the FDA. Anything that is allograft is not indicated. And this is only, and I'm speaking only about musculoskeletal purposes. So I'm not talking about malignancies, cancers, leukemias, things like that. I'm talking about strictly for musculoskeletal. So that's the answer to your question there. So thanks, Jenny. That's a great question. Next is from Jeff Marks. If there is an obvious bulge disc or multiple bulge discs as shown in MRI, can you still have treatment and improvement? That's an excellent question, Jeff. So when I talked about the degenerative pattern of discs and degenerative pattern of the spine, I was really highlighting one disc, but we can treat multiple discs all at the same time. So never fear, you don't have to feel like, oh, do I have to go through this 3 or 4 times in order to treat all the discs? Absolutely not. We are have our system down so that we can treat multiple discs all at the same time. So thank you for asking that. Jenny asked, I think there's a follow-up. She's asking, isn't that the same as PRP then? Great. Thank you for asking that. So platelet-rich plasma is only coming from blood. So platelets come from blood. Platelets are one of the 3 types of cells that live in your blood: white blood cells, red blood cells, and platelets. And that's extracted then from the blood. So you only ever need to give us blood from your arm, kind of like, as you would do lab work at a hospital. So that's what platelet-rich plasma is. We take those platelets and concentrate them with a little bit of plasma, and hence PRP. Stem cells are different. Stem cells have to be extracted from a tissue source. So in our instance, we're talking about extracting it from bone marrow, or extracting it in some instances. We didn't talk about it in this set of webinars here, but the other example where we take that from is from fat. But that's for another future conversation. So again, platelet-rich plasma comes from blood. Stem cells come from tissue. So that's the distinction there. But thank you for asking that. That was very helpful. Okay, so that's going to conclude. Oh, I think I see one more question. Okay, just Jenny thanking me. Okay, so that's the end of our questions there. If you do have questions, feel free to call. Feel free to email us. Feel free to jot down all your questions, bring it to the consultation. Honestly, we really do enjoy in-depth conversations about stem cells. This is what we do, this is what we love, and this is what we're good at. And so we always like to relay as much information as possible before you make these sorts of decisions. Otherwise, I will sign off and look forward to seeing you guys in consultation. Thanks, you guys.